Hey, I'm Kayla.
And I'm Stephanie, and this is the Chaos Chronicles.
Life's messy, weird, and totally unpredictable.
And we are here to talk about all of it. No filters, no fake perfect lives, just pure, unhinged, glorious chaos.
So grab a drink.
And let's dive right in. All right, guys. We are here in the studio with an extra person.
We have gained a person.
Barely a person, half a
A
person.
half a person.
It's fine.
A full person in our hearts.
Thank you. Thank you.
So this is Dr. Cook. She is a longtime friend of ours at the ER. She's also a mom and taxi driver extraordinaire for her children to and from all of the sports events that they do.
All of the sports, yes.
And she makes the best pumpkin chocolate
chip
chip
cookies.
that you were supposed to bring today. But I will forgive you this one time.
Gotcha.
So today we're going to just chat about like back to school related stuff because I don't have kids, but these two do.
It's true.
And
We're all going back to school next week.
Back to school starts.
Yay.
So, Steph, you want
Let's
to?
say I'm excited for it.
I'm excited because let me tell you, that tiny human and his shenanigans.
Yes.
Oh my God.
It's true.
I am not excited because that means traffic picks up and the
Oh,
school
that's
buses are
true.
back out. So,
I forgot about that.
Yeah.
as a person without the tiny humans,
That's fair. That's fair. All right. So some of the common things that we see when kids go back to school, especially that first day, the first day jitters. A lot of people, I guess a lot of kiddos have like anxiety, but they don't
Yes.
realize that that's what it is.
Yes, they have tummy aches, right? Yes, or they have upset stomachs. They don't want to eat. They're nervous. I will say, my youngest went to kindergarten last year, and he's so sweet. He was nervous. He was more nervous, even though he had gone to school. He had gone to pre-K. So luckily we were able to walk him in the first day and stuff. And he actually had one of his older brothers was there, which is super sweet. So he also walked him to class and said he would check on him and stuff. And then usually once they get over that initial hump, then they're fine. But
I think that's what it is, like the first day jitters.
yes.
Well, I mean, and then I think a lot of parents like forget what it was like.
Yeah.
And they don't they are set in the routine, so they go to the same job. They don't realize that if they change jobs, they're gonna have the first day jitters also.
Yeah.
And
No, for
that's
sure.
Basically, what it is with kiddos is it's the first day jitters. They don't, sure, it might be the same teacher, it might be the same kids, but I mean,
Yeah.
it's the anxiety of a new grade,
Yes.
harder things.
Will I have friends? Will I know anybody in my class? Will
Yeah.
my teacher be nice?
Yep.
Will I get the music teacher that I like? All of those things. But yeah, sometimes, especially with younger kids, they can't necessarily verbalize it, right? So they're
Right.
like, my tummy hurts. I was lucky because Max is 5 at that point, going on like 27, where he's like, I feel slightly nervous. He's like, okay.
He's so cute.
He's so cute. He does. He talks like a 47-year-old accountant. But so he was able to verbalize, like, I'm a little bit nervous, like, my tummy's a little bit upset because I'm nervous, so at least he was able to do that. Not all kids or adults, quite frankly, are able to verbalize that. So, so just, lots of extra grace, the first couple days of school. It is new. In Loudoun County, you only have 2 days, and then you have the weekend anyway, so.
Right. And then they have the following Friday off.
Correct.
So I was like, wait,
and
what?
then the Monday after, it's like they're in school for like a month before they have a full week of school.
Yeah.
So, it's a gradual easing in process, but yeah, just to be extra understanding, but also know that they probably don't have a stomach bug, and you probably don't have to take them to the emergency department. I know.
We don't have to go straight to the
I
ER.
know,
What?
I know.
Is this crazy nonsense?
I know. Yes. So, anyways, but yeah.
All right.
First day jitters for sure. And I mean, I feel like we get that too. Like you said, that adults have like a new job or whatever.
Yeah.
So.
Yep.
sometimes I get that first day jitters when a new doc is starting.
Right? I'm like, how is this gonna
I've
go?
been there for 5 years, but we'll see how it goes with you.
It was just July. We do have new people
We do,
starting.
yes.
So, yes.
So
Again,
glad
some
I
grace.
I'm so glad I don't have to deal with that anymore.
Yeah.
But yeah. Another thing, like with schools opening and kids going back to school, they start getting sick. Not just like the first initial jitters of everything, but they start commingling with each other.
Sharing all the germs.
All the germs.
They are so
The
cute, but they
germs
carry
bonds are
germs.
The finger
Right?
Yes.
It's always the
Yes.
finger picking.
It's always, yes. Yeah.
All right. So,
And germs are good to an extent.
Yes.
Don't be one of the people who have like the hand sanitizer immediately. Like germs are good to an extent.
Correct.
First time parents.
Yes. Yeah. Well, I even feel like so. Like all my kids went to daycare, and like they were sick a bunch when they were in daycare. But by the time they went to elementary school, knock on wood, like they very rarely got sick because they were exposed to so much stuff already.
Right.
So that was, I guess, the blessing and the curse of
Them being
daycare.
sick when they're little.
Yeah. So,
Yep.
but yeah, they're going to share germs. I mean, the main thing is, most schools, if they have a fever, which is a temperature greater than 100.4
Thank you.
orally,
Yes.
right? 98.9,
Not a fever.
not a fever. Even if you run at 97, it's still not a fever.
Nope.
That's
nope.
just for adults as well. Pet peeve.
Pet peeve is a little bit between. I think that's like a general consensus
Correct.
between all ER personnel.
Correct. Yes. So, anyway, so most schools, if they are running a fever, they want them fever-free without medication for 24 hours before
Right.
returning to school, so that they hopefully do not pass on whatever they are carrying. Most likely viral or strep, which is not viral, but either way. So just follow the guidelines, because otherwise the entire class gets
They're
sick,
gonna get
right?
sick.
Yeah.
I think that's another thing is parents like they either go to the extreme of they don't medicate and they rush straight to the ER,
Yes.
or they medicate and then send them to school.
Right. Being like, well, they don't have a fever now. Yes,
Right.
that's because the medicine is working.
Yes, it's doing
Congratulations.
its job.
Yes,
Good
thank
job.
you, Tylenol and ibuprofen.
Right.
But yeah.
But yeah, the rushing straight to the ER, I think that's another thing that we see once school kicks in.
Yes, because they want a note saying that they can go back.
Yes.
And I can't tell you when your kid's not going to have a fever anymore, so I
Yeah.
don't know when they can go back.
Yep.
We can give you a note saying that they were evaluated in the emergency department, but you still have to follow the rules from
Yeah.
your school, whether it's daycare or public school, private school, whatever. They usually have specific guidelines, so just make sure that you follow them so you're not
Yeah.
risking everyone else in the class
Like you
getting
said,
sick as well.
For the most
Yeah.
part, it's 24 hours of being fever free without
Without medication,
medications.
right.
That's the key part. There's without the medications.
Correct. Yep. Also vomiting and diarrhea. Vomiting, especially, you want them symptom free for greater than 24 hours
Yeah.
without medications.
That one
yeah.
I always did like 48 because I'm like,
Yeah.
let's not, because
Yeah.
that
Don't wanna push
first
it.
day,
Yeah.
that first day is
Yeah.
kind of like a buffer, and I'm like, if you
Yes.
eat again, are you going to vomit it up later on, or is it just going to run right through you?
Yeah.
So I kind of do like
Yeah.
a 48-hour grace
Yes.
period with that one.
Yes. Judgment call for sure on the, but it's not 2 hours. It's
I
at
know,
least a day
right?
or two.
They do. They're like, they haven't thrown up in 2 hours, 2 or 3
Yes,
hours. They're like,
yes.
okay, let's send them to school. I'm like, no, let's not.
Correct.
Let's not.
Also, vomiting in itself is not a reason to come to the emergency department, as long as the child is peeing, pooping, etc., making tears, able to keep down a little bit of fluids in between. Vomiting twice is not going to dehydrate your child
Or an adult.
or an adult.
Or an adult.
The adult.
All weekend long.
Yes, like
Oh,
several,
my God.
like 24 hours without keeping anything in, that type of stuff. I mean, by all means, but vomiting once or twice you're not dehydrated. It's
Right.
okay. Just lay down, take a little rest. Now, again, if you cannot stop vomiting and are continuing to profusely vomit, that's one thing where we can
Yeah.
give you medicine to help break that cycle. But vomiting twice is not
It's not. No.
an emergency.
And it's not a vomit, and that's not twice.
Correct.
That's
No.
one episode.
That's one
of
episode,
vomiting.
you guys.
There's got to
It
be
doesn't
time
count.
in between.
Correct. Yes.
I think the other thing that a lot of parents freak out about is their kid hasn't eaten all day and they vomited.
Yes.
Food is
Yes.
not.
Correct.
Yeah, you can go 3 weeks. I learned this on
The
Naked
threes.
and Afraid.
Oh, there
The
you go.
threes, the rules
You
of
go
threes.
3 weeks without food before your body starts to shut down.
Yes.
Yes.
What
Yeah.
is it?
You can only go 3 days without water.
Yes.
You can go, what is it, 3 hours in the sun in extreme heat, 3 days without water, and then 3 weeks without food. It's the rules of 3.
Yay,
Yeah.
yay reality.
It's the
I guess
only
it taught us
reality
something.
TV I ever watched, but I did
I
learn
like
that.
it. I like
And
it.
honestly, like when I have a stomach ache or I'm vomiting, I don't want to eat
Correct.
food.
Right. That's something that I always told the
Like-
parents when I was discharging like the kiddos.
Yeah.
I'm like,
Yeah.
remember, if you don't want to eat the food
Right.
because you're nauseous when you're sick, they're not going
Right.
to want to either.
I would say
That's
no
fine.
no child voluntarily starves themselves, right?
Right.
So like once they start getting an appetite, start with like goldfish,
Yeah.
saltines, not like,
Full on
a
meal.
burger.
Yeah.
The burger,
Right.
that's the one they
Right.
always go with. The burger or the hot dogs.
Or
And I'm like, well,
Chick-fil-A.
yes,
Yes.
that's the other
Yes.
one. Yeah.
Yeah, I would wait, a little bit before introducing that. But, like
Yeah.
I said, goldfish, some broth, some Gatorade, some popsicles even, because it's
Yep.
less fluid and they can kind of,
I
take
think
it
they
easy.
tolerate it a lot better with popsicles.
Yeah. Yeah.
The Pedialyte popsicles.
Yeah, the
Yeah.
Pedi Pops. Yeah.
Yeah, sometimes the kids, sometimes they're a little salty. I don't know. But either way, popsicles
I.
of some sort. Yeah, I know.
Salty too.
I know. My husband drinks like those like elements and all that. Like,
Oh no, I
I
can't.
can't do it.
I
I'm
can't
like,
do it.
"Bleh."
I force myself. Like if I get sick, I'll force
Yeah.
myself to do it.
Yeah.
But it's not the most appetizing whatsoever.
No. But yeah, the main thing is hydration with anybody with vomiting. So the food will come after everything settles down, but then you start small, like small frequent feedings, like an infant, right? So like a little goldfish here, little toast, stuff like that. We use it with the brat diet, like
yeah.
bananas, rice, applesauce toast. Not necessarily all together, but
All on one platter. No,
Right.
break it up.
Yeah,
Little
but
tiny
just,
pieces.
yes, but just things to start with, kind of to gently introduce
Yeah.
back into the child's diet. Yeah.
And
Yeah.
little sips of water.
Yeah,
Doesn't,
I was
like
gonna
don't
say.
don't
make 'em
expect them to
chug.
chug it, the
Yes.
whole thing, because then
Yes.
they're gonna throw up.
Which is why the popsicles are nice too, because it
Yeah.
kind of is like a slower, ingestion, as it were.
That's
instead
one of the things that I
developing.
used to tell the parents of the toddlers, because toddlers they get thirsty,
Yeah.
and as soon as they can drink, they'll just chug.
Yeah.
I always
And
send them
then-
home with the oral syringe and be like,
Oh,
here,
Yep.
take one of these like every 15 minutes, just a little
Very
one, and then once they can tolerate that, kind of move on from there. But they
Yes.
do. The tiny ones just chug
Yes, very good suggestion.
Yeah.
Yeah. Yep. Other things that we've been seeing a ton recently, hand, foot, and mouth. Is
that's right. I keep
rampant.
seeing that on the mom pages.
Yes. So I will tell you a story. Okay. No people. But the other day I had 3 parents bring their child in because they had a rash on their hands, their feet, and in their mouth. And hand, foot, and mouth was going around their daycare. So what do you think the child has? Anyone?
Chicken pox.
Hand, foot, and mouth.
It's always
I
the
know.
measles and the chicken pox.
I know. So common things being common, if it's running around the daycare, and they have all of rashes on the actual name of the disease. I mean, it's Coxsackie virus, but it's called hand, foot, and mouth for a reason.
Right.
They can also get spots other places. Poor Max had it like when he was like a year and a half. He looked like a leper. It was kind of bad. It was during COVID too, so I was like, oh, people probably think he's like some sort of diseased.
He's disease. He's patient
Yes.
zero.
Yes. But with hand, foot, and mouth, it is. I mean, if the child is not eating or drinking, mainly drinking, like we just talked about, and you think that they're getting dehydrated, that's really the only reason that you need to bring them into the ER. Otherwise, it's ibuprofen and Tylenol and symptomatic treatment at
Right.
home.
Yeah.
There is no
So-
test, you guys.
Correct.
So don't ask us to test them because there isn't one. I'm sorry.
And there's no magical medicine to make it go away either.
No, the
unfortunately.
rash usually crusts over after about a week. But same thing, like they have to be fever free, and the rash has to be crusted over until they, before they can go back to school. Yeah. So,
Yeah.
but yes, if you say what they have in the title, that's what they have.
Right? Odds are that's what it
Yes,
is,
yes.
guys.
Yep. Yeah. So.
So a lot of people have actually, and I was actually just on one of the mom pages, they were talking about new COVID strains
Oh.
and having GI issues.
And this is when you got are going to be kicked out
That's
of this
why I'm gonna
group
get kicked out
because
I flat out said, I'm like, no, it's not new, and the
Yes.
GI issues have been going on with it
Correct.
for
Yeah,
years now.
yeah,
Like
yeah.
we're
Depending on
5
the
years
strain.
into this now, guys.
Yes. Yeah, depending on the strain for sure.
Yeah.
I mean, even like the flu, right? The flu is mainly a respiratory illness, but people can still get GI symptoms with
Yeah.
it. But
And then they call it the stomach flu or something like that.
correct.
Yeah,
Yes.
it's the same.
Yes.
It's the same thing. It just depends on the strain and who you are and how you react to it.
Correct.
That's basically it.
Correct.
All right, sports injuries. Kiddos are running around with their friends, and their friends are all telling them to go jump off of this and go jump off of that, and
Yes.
they all do.
Yes.
say between
So
that and football's back in session.
I know, football's
and-
back in session.
and e-bikes.
Oh,
No,
For the love of all things holy, guys.
No. No e-bikes.
No e-bikes.
No
e-bikes
e-bikes.
and the scooters.
Yes.
Yes.
We've had so many scooter injuries
Correct.
the past couple weeks.
And if you are going to be dumb enough to do that, please wear a helmet.
Yes.
even if you're an adult,
Yes.
kids and adults wear helmets.
But let's be real. No adult should be on a hoverboard. No.
There goes my fun for the
Man,
weekend.
that was going to be our next episode.
No. So I mean, I was a gymnast. I have very good balance, and I will not step foot on one of those
I
things.
can't either.
I mean, I took care of a couple people like a couple Christmases ago that they literally went into the Christmas
Yes.
tree because they can't.
It's
and,
always
yeah.
the adults at Christmas
It
time.
is. It's the adults on the hoverboards.
Yeah.
Like, the kids can usually manage them okay, but adults should not be on a hoverboard.
No.
So just
They shouldn't be jumping at the trampoline parks either.
don't do it. Well, no. So I still do
I
that.
Yeah, but again, like you said, you were a gymnast.
It's
you
true.
know how
I
to
do.
do all
Yes.
that. You have
Yes.
the ankle strength, and most adults
Correct.
who don't do that on a regular basis.
100%. I really want to do it.
Well,
You should do that and then like take the cameras and go record us.
I'm in. I'm in.
All right, we're done.
No,
We're
for sure.
doing this.
All right, for sure. No, so my 13-year-old the other day, we were looking for something to do, and he's like, we should go to a trampoline park, and I was like, absolutely not, because one of you is going to break your elbow or your wrist,
See?
and hockey season is about to start, and then you won't be able to play for 6 weeks, and I already paid for the season.
I already paid for the season, so you're playing
and we don't want you to do whatever with your team. So, anyways, so I would say, there's been a ton of, ankle sprains, all that other type of stuff. I'm so bad. So my oldest broke his wrist a year and a half ago, and during a game, and I did not take him to the emergency department because it wasn't facing the wrong direction, and I was like, they're just going to do. So what we do in the ER when you come in with a bony type of injury, right? So we do X-rays, okay? If the X-rays are normal, but you're still tender, we put you in a splint, and we have you follow up with the orthopedic doctor in the office, okay? If the X-rays are abnormal and we need to reduce something, we line it up, or we call orthopedics if we need them to come in, and then we still end up putting you in a splint. We do not cast in the emergency department because we have to allow for swelling within the first 48 hours after the injury, and if we cast it, it's too tight, it cuts off the circulation to your hand. So we splint. So a splint is like a fiberglass type of material, and then an ACE wrap around it, so it's a big bulky thing, which kind of basically does the same job as a cast, but it again allows for the swelling. So if it's too tight, you can come back, we can take it off, etc. But we always end up having you follow up with the orthopedist. Yes. So when my son hurt himself, it was a Friday night. Nothing was facing the wrong direction. And it was kind of like a weird thing. So I was like, well, we'll put you in a brace. And I was like, if it still hurts on Monday, then I will call the orthopedic office because then they will do an x-ray. And then if you need it, they will cast it at that point, which is what we ended up doing. Because we had a little discussion because I said, we haven't met our deductible yet. If I take you to the ER, it's going to be like thousands of dollars, right?
Tell me you're an ER mom without telling me you're an ER
I mean,
mom.
I've also stitched them up at home and everything. But,
okay, I'm not
with no numbing medicine, so don't call CPS. But, and that's what they ended up doing. So we did an x-ray, and they put a cast on, and he had like a fraction of the growth plate, whatever. But, that's another option if available because, again, we're always happy to see you, but at the same time, if nothing's facing in the wrong direction, everything's neurologically intact, you can definitely call the orthopedic office and schedule an appointment with them, and just keep it immobilized in the meantime. But
and I think with that also, if you do go to the ER and your child is in pain, please give them Tylenol or Motrin.
Yes.
Please. Same with the fever.
Yes.
Please give them Tylenol and Motrin.
Yes. We believe that they are in pain, and we believe, unless you tell me that their temperature was 109 at home, I still do believe that they had a fever. Yes. So please medicate them, because that way they're more comfortable, they're less cranky, they're more likely to cooperate with everything, and
you're less likely to end up in the ER,
right?
Because they're feeling better.
And the Tylenol that we give them in the emergency department is the same Tylenol that you would give them at home, but it costs way more when you get your bill.
It's the same one.
It is the same one. It's not magical.
Dang it!
Yeah.
I thought we had the magical
Tylenol.
Yeah.
I mean, we do have rectal Tylenol. They won't swallow it, so that's magical. I don't know.
I have had one parent ask me to give them their kid that so that they didn't have to fight them at home.
Correct. Yeah. No. Same.
I'm like,
same.
What?
I've also had parents ask if we could do the antibiotics that way, and I was like, no, not twice a day for 10 days. Nor is that a thing. So.
Can you imagine? Oh God, that poor child. Traumatized for life.
I know. I was like, no, that goes by mouth. So, anyways, but yes, Tylenol or ibuprofen, ice, all important things as well. And then always happy to evaluate, but.
What is it for sprains and stuff? Rice, rest,
ice,
compression, and elevation.
Yeah.
Yes.
Ice 15 to 20 minutes at a time. Elevate usually above the heart if possible. So if you injure your ankle, if you're on the couch, put it on a pillow, elevate it. All of those things. Ace wraps. Yep.
If your leg starts hurting towards the end of the day, elevate it because odds are you've been dangling it down for too long. If you're at work or what have you, it'll help with the pain tremendously.
True. Also, if you injure your knee and it's swollen and blue and stuff like that, and it's not broken, and then 4 days later your ankle looks swollen, it's just the blood that was underneath the skin up around your knee, and gravity has taken place. You also did not injure your ankle. It's just that everything's pulling down because of gravity. So. Same
with facial lax, right above the eye. If you wake up with a black eye a couple days later. Yep. You didn't get hit again.
Nope, it's true.
Nothing has changed.
Nothing has changed. Just gravity, as we all find out as we get older. Just gravity taking over.
So not not excited about that
I
one.
know, I
I
know.
was like, dang it.
I know.
All right, let's talk. Speaking of facial acts,
Mm-hmm.
anything on the face and the scalp and even on the hands tends to bleed a lot more than in other places.
Mm-hmm.
Can you kind of go over that with the parents because they won't believe the nurses, but they'll believe the doctor?
Yes. So, yes, scalp and finger lacerate. Any extremity is very well perfused, so they bleed like crazy. Pressure, elevation, right? And then also on the face, yeah, they bleed like crazy. It's again, just pressure and
I just wanted to say something.
that's fine. Yeah, just honestly applying pressure and then hoping it to stop. Ice also helps with that because it constricts the blood vessels as well. And then, my rule of thumb is that if you can pull something apart and see like the subcutaneous tissue underneath, it usually needs some sort of closure. I don't really like skin glue. I've just had bad experiences with it where something gets glued and then like the glue comes off and it opens back up. So steri strips or stitches, fine. I mean, like I said, I stitch up my own kids at home, not like to practice, but when they
When they actually hurt themselves,
when
you
they
guys.
like hurt each other playing basement hockey, etc. So yeah, and the other thing I will say is emergency departments are staffed with board certified emergency medicine physicians and usually either nurse practitioners or physician assistants that have worked in the ER for a very long time. We are very adept at stitching up your child's face. You do not need a plastic surgeon.
No.
If you do need a plastic surgeon, trust us, we will say that you need a plastic surgeon and then call them. But if it is a small laceration here, I mean, honestly, I've been an ER doctor for 18 years. I have stitched up a multitude of things in a multitude of places. So if we feel as though you need a plastic surgeon, we will tell you. But even plastic surgeons, when they do it, they will tell you there will still be a tiny scar because you have sliced something open, right?
Yeah.
Like it's just the way that the skin heals. So even if they do it, there will be a small scar there. And if you don't like that, you can do treatments after with vitamin E oil, whatever. You can always get it lasered later to decrease the scarring. But just because the plastic surgeon comes in does not mean that you're not going to have a scar. And also a lot of emergency departments don't necessarily have plastic surgeons available on call. But if we do feel like you need one, we will certainly tell you.
And a lot of plastic surgeons, at least when I've, had to do like consults and stuff with them, will
Yeah.
flat out tell you, we'll see you in the office in a couple of days,
Correct.
or we'll see you in the office,
Yeah.
tomorrow. They won't come to the ER
Right.
unless it's
That's
like
true. Yeah.
bleeding profusely and they can't get the bleeding to stop.
Yeah. Or if it's like
And in that case, we don't need a plastic surgeon.
No.
Right? Right? We
Yeah.
need vascular at that
Emergency.
point.
right. I will tell you, even like people that have like amputated their fingers, when I talk to the plastics and the hand people, they're like, oh, just put a nice like wet to dry dressing on there and we'll see them in the office tomorrow. And you're like, then they're missing their finger. But that's like standard operating procedure.
Yeah.
So, which also brings me to another thing. Most hospitals are not like Grey's Anatomy. We do not
Right?
have like specialists hanging out in the ER. We usually have to call them. Sometimes they're not too happy that we're calling them, depending on what time.
Correct.
They very, very rarely actually come to the emergency department. So, just managing expectations.
Yeah, right? And then like talking about lacs and stuff, there's a certain window that we have to actually suture them up.
Usually within 8 hours.
And then dog bites. That's a big thing.
Yeah.
Parents come in with dog bites, or the kids come in with the dog bites.
Yeah.
We don't typically suture those up.
No, unless they're like very large and gaping, then we'll kind of like close them loosely. Or facial ones we usually close. Most of the other ones we leave open just because there's such a high risk of getting infected. So if we close it, it closes kind of that bacteria right underneath the skin. And animal bites are just prone to get infected. So even if we clean it out super well, if you're managing it super well and cleaning it at home, and we put you on antibiotics for all these animal bites anyway, they can still get infected. So even the best laid intentions. So that's why I always tell people to kind of keep a close eye on those. So
I think that's one of the ones where I'm like, I'd rather just start the antibiotics because with my luck,
Yeah.
it would turn septic before I sat.
Especially dog bites. I mean, dogs
so gross.
Their dog mouths are gross. I mean, I love dogs. I don't have one because I have 4 XY people living in my house. So I can't do it. I can't do a dog too. So
that might be the only way you get into your XX.
that's true. That's true. Maybe she would clean up her socks. I don't know. But I do love dogs, but their mouths are disgusting. They lick themselves. They are out in the yard. They're picking up all sorts of creatures and everything from the ground.
Skunks like my dog, yes.
Yeah.
Yep.
So they're just dirty. So you clean them really well, and then antibiotics. So yes, and then I would say going back to the sports stuff with head injuries. So we see a bunch of head injuries in the ER.
Yeah.
So I mean, my older two play hockey. So I have 3 kids. My older 2 play hockey, and then number 2 and number 3 both play lacrosse. So there's a lot of contact involved. So sometimes without helmets at the house, but
That's at home. It's fine.
it's fine. So my middle one actually did have a concussion like 2 years ago. Reasons to come to the ER after head injury. Okay.
Okay, well,
That was on our
Yes.
list.
concussions is
Yes.
on my.
That one is on our
I
list.
feel like we just need to even define because there's so
Yes.
much about concussions with football
Yeah.
players, and you
Yes.
see that, and people are like, "I have a concussion, I have a concussion, I have a concussion,"
Yeah.
but they don't actually know what a concussion
Yeah.
is
Yeah,
or
right.
means,
Right.
and they're all
So-
like, "I'm gonna die, I have a brain injury."
So the ER, the main reason to come is if we think that you need some sort of brain imaging. Okay, so that is like high risk head injury. So it's also like car accidents, falls, etc. So if you have a loss of consciousness, right? If you are having vomiting, if it is like a very extreme mechanism, as we say, so like if you fell like 10 stories and hit your head on the way down,
Right.
if those type of things.
Please don't come to
basically-
our hospital.
I know, right? We're not going to
I
get
need a trauma
center
center
call
for the
911.
10 stories down.
Yes. That being said, the imaging that we do in the emergency department, we do CAT scans. We do not do MRIs unless we think that you're having a stroke. Okay, and that's
And even then,
honestly
it's
on
not
admission.
admitted.
It's
Yeah.
not from
Yeah.
the ER. So I would say we admit people for MRIs for strokes, and then if we think that you have like an emergent spinal problem where you're unable to urinate or you're pooping your pants, and we think that you need like emergent spinal surgery. Otherwise, we don't really do MRIs. Certainly not ones of your knee or your elbow or any of that type of stuff. So we do CAT scans. So the CAT scan looks for skull fracture and it looks for internal bleeding. There is no picture that tells us that you have a concussion.
Correct.
There is a picture that tells us whether you have a internal bleeding in your brain or have broken your skull. Okay, so a concussion is a conglomeration of symptoms, right? So, I mean, you guys know, but blurry vision, nausea, vomiting, dizziness, some like brain
Headaches,
fog,
yeah.
headache, feeling slightly off balance. Also, if you have amnesia to the event, we usually would do the CAT scan just to make
Yeah.
sure as well. And this is another thing where parents, especially with youth sports being what they are today, are basically, well, when can they play again? Not until they are symptom free. And we only see you in the ER for a short period of time, so I always have you follow up with either a pediatrician or neurology. Or there's also concussion clinics around the area that you need to get cleared before you return to play. Because if you're not fully healed, and then you get another concussion, symptoms are worse, and that can lead to more kind of permanent long-term issues. So
Yeah. I actually had a patient at another hospital I worked at, and they were like back to back to back, 3 concussions in a row. But that
Yeah.
third one, they actually found a head bleed.
yeah.
I was like, whoa.
Yeah.
I was like, that one. Okay.
Yeah, no bueno.
No bueno
Yeah.
on
And
that.
honestly, like, especially some of these kids are so young. I mean, it's not, you have to think of the long term, it's not worth it,
Yeah.
because,
The
contrary to popular
radiation.
belief, contrary to popular belief, most kids around here are not going to play professional sports.
What?
I know, shocker.
I believe that
You
mom
shattered their
you need
dreams.
to Put that in that mom group.
I know.
Don't tempt me, because I don't post anonymously either.
So honestly, you have to think like long term, like what is more important, them playing in a game where they could possibly get injured again, or them actually having like appropriate brain function into adulthood where they can be functional adults, right? So just things to
Even
think about.
adults who play professional
Correct.
football
Yeah.
have
Yes.
such bad concussions. I've
Yep.
again had a patient at one
Yep.
point was in his 40s, late 40s, who had played high school and professional football, had so many concussions that he actually ended up developing like early onset dementia.
Yeah.
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 So that's the other thing is a lot of parents are, like you said, they're so gung ho about getting their kid back on the field, and I'm just like,
Yes.
is it really worth it?
Correct. Yeah. And if they do have a concussion, Tylenol, ibuprofen, lots of rest.
No TV and electronics.
Right. Like very limited screen time. I usually do give a note for the school to allow them to have like breaks and stuff like that to get brain rest and everything. So
Well, speaking of brain rest, I know when we were growing up, they always told us don't let them fall asleep.
Yeah, so don't do that. You know, that used to be a thing, and I always tell people the only you know only thing that serves now is to make everybody more tired and more cranky,
Tired, cranky,
right?
and
And
angry.
then yes, so no, I mean especially if we do imaging and we know that it's normal, like there's no reason to not let them fall asleep. And they're probably actually going to be more tired and going to need more rest, so you definitely should not be waking them up every 2 hours to check on them.
Yeah.
You know, I do say, you know, when we have small children that have head injuries, and we usually try to avoid CAT scanning, like super small kids, you know, they're still allowed to take a nap and everything as well. Because again, if not, more cranky, more tired, etc. But usually, you know, we just tell the parents to kind of watch them, you know, throughout the day, and if they have any like change in their mental status or like I said, the profuse vomiting, anything like that, you know, to bring it back for evaluation. But little kids, especially, are made so that they have a very thick skull in the front and in the back, because that's usually where they hit their head. So it does serve as a very good protection.
It's like the body knows what it's doing.
It's
What
true.
on
That's
earth?
why they have this like
Evolution.
right, yeah. And then, but on the sides of the brain or the sides of the skull and stuff like that, the bones are a lot thinner. So if they hit their head on the side, again, or any of the other things we talked about, like loss of consciousness, vomiting, that type of stuff, then we'll usually scan them. But if it's the front or the back and they have like a big goose egg there, they're usually fine.
Yeah.
So.
Again, Tylenol, Motrin for the pain. Please
Ice,
medicate them.
ice if
And
possible.
ice.
Yes. Yeah.
Yes.
It's hard to put ice on a toddler. They're usually not too keen on it, but you know,
It's too cold. They don't like it.
Right. Yeah, which I get. Yeah. Yep.
Alright.
Yep.
So I want to jump back to fevers really quick.
Oh, yes.
Only because we get a lot of kids who come in, especially the little ones, with seizures, the febrile seizures.
Yes.
Again, when we were growing up, anything over 104 degrees, they take them to the ER.
Mhm.
So the correlation, not necessarily between how high the fever is and seizures,
Mhm.
it's more so how big of a jump in
Mhm.
temperature.
The rapid rise. Yeah.
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 I think that's the big thing is we get some of the parents bring their kids in because their kid has a fever of 104, got to take them to the ER right now.
Right.
I'm like, no,
No.
guys, no,
Nope.
it's okay.
No. Yeah. I mean, as long as you medicate it, and you just need to medicate them and medicate them with a proper dose.
That's the other thing. The
Yeah,
other
all
thing.
of these things just keep coming.
No, right? The
All
proper
these
dose.
pitfalls.
The proper
Yes.
dose.
So for Tylenol, it is 15 milligrams per kilogram. Kilograms is pounds divided by 2.2. All right, I know it's some calculations, but we do them. You can do them too. So
We
you
all
know,
have
We all have
calculators.
calculators on our phones.
Correct. So you take their weight, you divide it by 2.2, and then you get their kilograms, right? So pounds to kilograms. And then it is 10 milligrams per kilogram for ibuprofen, 15 milligrams per kilogram for Tylenol. So some of the kids, you can follow the thing on the side of the box because they're within that range. So my kids are tiny for their age, so it
I
doesn't
wonder where they
necessarily-
get that from.
I know. So, and then there's other kids that are very beefy, husky. Well, maybe not within the range, and so sometimes they actually get underdosed because their parents are following the box when it's actually they should have a higher dose. So when they're like, it's not working, the temperature's not coming down, and then we talk to them. Similar when a patient, like an adult patient, said, "Well, I took one Motrin and it didn't help." Well, one 200 milligram ibuprofen or Motrin or Advil, all the same thing, but it's what we would usually use for like a 40-pound child, and this is like a 180-pound adult. So of course it's not going to work. So appropriate dosing. Tylenol is every 4 to 6 hours. Ibuprofen's every 6 to 8 hours. We usually tell you to stagger them. So what I do with my own kids, Motrin, 3 hours later Tylenol, 3 hours later Motrin, etc. while they're awake. I usually do Motrin right before bed because it lasts longer.
Yeah.
And so they can get a little bit more sleep. And then if they wake up in the middle of the night, definitely give them some more medicine. You do not have to wake them up to medicate them if they are sleeping. Let them sleep. Yeah.
because they need it.
Yes, they'll tell you when they don't feel well. So,
Yep. 100%.
yes.
I guess that also comes back to kiddos with ear infections. Please give them Tylenol and Motrin for the pain.
Yes. Because when you're an adult and you have an ear infection, you realize why the children scream all night long.
Right? I'm like, oh.
Yeah, it's very,
It's
very,
irritating.
very painful.
Very
Yeah.
irritating.
But also not necessarily something you need to bring them in for 3 a.m. You could
No.
probably wait and go to the pediatrician in the morning to the
Yeah.
sick walk-in hours. Again, ERs are open 24/7 for a reason, but
For emergencies.
you can give them Tylenol and Motrin and probably wait 4 more hours and then take them to the pediatrician walk-in hours in the morning if they are available. But
Yeah. If
Yeah.
not, I mean, a lot of them do, but a lot of them
Yeah.
also have like the sick
Same-
hours,
yeah, same day
day
appointments and
visits.
stuff,
Yeah.
Yep.
All right, let's see. There was another thing that I was going to ask about. Oh my gosh, and I completely forgot about it. It would not be an episode if I didn't forget about something.
I know. Well, I had written down everything we had talked about.
Okay, what
so-
else did we talk about?
And we covered everything, so you didn't tell me what
See,
everything
we are so
extra
efficient.
thing.
We are
on top of
people.
it. Get straight to the point. We don't have time for the BS.
Yeah. You guys know me. I don't know. Yes.
Yeah. So everything you had told me. So if you had thought of something separate,
There was something that while we were like mid conversation, I was like, oh, we should probably cover that topic. Tiny humans, the tiny ones.
Yes.
Them going to daycare because the older kids are going back to school,
Yes.
and all the breathing issues.
Oh, yes. Okay. So definitely any sort of respiratory issues for the kids, you need to bring them in, right? Croup is very big.
and not just
around this
like
time of
they
year.
can't breathe because their
Right,
nose
no,
is
nose
like
is
actual
stuffy.
like respiratory,
breathing.
like their lungs, yeah.
Yes.
So good point. So try and suction if they've got a bunch of snot, mucus, as it were. So either with a bulb suction, or they have the nose Frida thing where you suck the.
I know, with your mouth. Like, she's like, I can't do it.
I made my husband do it. I was like, I can't. If that snot comes through that filter and
There's-
into my mouth, I'm done. I'm done.
Oh, I've had a friend that happened to.
Everyone
See,
keeps
I
saying
can't.
it's got a filter. No, I
Nope,
don't get
nope,
my
nope.
child,
No.
future child, will never
Nope.
be nose freeded by
No.
me.
Nope.
So humidifier is great. The bulb suction, even Vicks Vapor Rub, like on the chest or on
Yeah.
their little feet, will help as well. Like I said, humidifier. There's no cough medication, by the way, for children in general.
No.
So yeah, humidifier, suctioning, all that type of stuff to help with the mucus. So if they are having respiratory issues, so like either a barky cough with croup, it's very distinct. Like literally,
Sounds
we
like a
can
seal.
hear the kid in the waiting room, and you're like,
We
oh,
can't.
the kid's
They
got
got
croup.
croup.
Yeah, where are you taking the kid? So with croup, we tend to give a dose of steroids orally, Decadron, and then if they're struggling to breathe and they have stridor, not wheezing, but stridor, we give them like a racemic epinephrine and nebulizer treatment. So the difference between stridor and wheezing, stridor is upper airway, right? It's
It does. That's what it sounds like too.
Yes.
You can tell.
Thank you.
You do that so well.
Wonderful. Yes.
Years of
Yes.
practice.
Here's a practice. And then wheezing is actually lungs, right? So where your airways are constricting down, and there's actually, wheezing like we see with asthma or sometimes with bronchiolitis, with RSV and stuff.
Yeah.
So yeah, any sort of respiratory issues, because kids mainly, the sickest ones are usually respiratory kids.
Yeah.
So they can go downhill pretty quickly. So if they're rapidly breathing, obviously if their lips are turning blue or anything like that, I would just call 911 for that.
Yeah. Oh, yeah.
Well,
Absolutely.
that's the thing. I think we've noticed, especially this. I mean, we got a lot of people right in our hospital area that are right there too.
Mhm.
But don't run in with your child who's limpless. Call 911.
Oh, yeah. That's the other thing.
Yeah.
That is what they're there for. And
Yeah.
yes, I know you can get here in 5 minutes, but there's 5 minutes of things that
Could have
be
been
done.
Yeah. I think that's one thing that the parents don't realize is that, yes, they can get there within the 5 minutes, but in the 2 minutes it takes EMS to get there, for that 5-minute travel, they could already be getting medical attention.
Mhm.
Yeah.
That could actually be a matter of life or death at that point when it comes to breathing
Mhm.
issues.
Yep.
I don't think they realize that.
Yep, for sure.
And then I think, the other thing with croup, I know, especially like during the winter time,
Mhm.
parents wake up because the kid's making a awful barky
Yes.
sound, and then by the time they get to
Yeah.
the hospital, they're
Good,
better.
yeah, 'cause they
It's
go
the
outside.
cold air. It's the cold air that gets them.
Yep.
It kind of like relaxes everything so that they can, it reduces the inflammation so that they can actually breathe a little better.
Mhm.
But I promise you guys still need to be there because once they warm up again,
Yep.
they will probably start again.
Yeah, and these all of these things usually flare up in the middle of the night.
Always.
It's never during the day.
Nope. Never. I don't think I've ever
Right.
taken care of a creepy kid in the middle of the day.
No, right? No, it's all,
Ever.
literally it's always in the middle of the night.
Yeah.
So that's definitely a reason to come.
Yeah.
Would be any sort of respiratory issues.
Yeah.
For sure, especially with the kids. Yeah.
I think like what parents also come in the middle of the night for is because the kid's constantly coughing.
Yeah.
because the changing of positions
Yep.
kind of they start. I mean, if you lay flat, if you go from sitting up all day to laying flat,
all
it's
the
moved all
drainage.
it's moved all the drainage and the gunk that's going around, so it's going to increase your coughing.
Yep.
That is normal.
Just like with adults.
Yes. Just like Dr. Cook said, there is no magical cough medicine for kiddos.
Yeah.
The humidifier is going to be the best bet.
Yep.
I've told parents, especially if they have like that barky sound, if they're
Mhm.
breathing okay and it's just scaring you until you get to the hospital,
Mhm.
either go outside or put their face in a freezer.
Oh, there you go.
The parents look at me like, what? I said, yeah. I was like, don't put them in the freezer. I said,
Right,
just
just
open the
open it,
freezer
let the
door,
cool
let the
air,
cool
yeah,
air, and then,
yeah.
do what you need to do from there.
Yeah.
I said, but definitely come in.
Yes.
But yeah, the coughing gets worse at night. Everything gets worse at night.
Yep.
The fevers spike at night.
Yep.
Just because Murphy's Law.
Yes.
No, I'm kidding.
Yes.
There's a scientific
All-
reason for
yeah,
it, but
all normal things. Anecdotally,
Yeah.
all very normal things. So, but yes, medicate before you at least for the fever.
Yeah.
But yeah, if they're having any sort of breathing difficulties, then better to
call
better to be
911.
safe than sorry
Yeah.
for sure. Yep.
Yep.
That's what they're there for.
Yes,
Even at 3 a.m.
It's true.
They work 24/7 also.
they do.
Yeah.
Trust me, we meet them in the middle of the night.
Yes.
It's true.
All right. Anything else that you can think of?
Any back to school tips?
Oh gosh, buckle up.
Buckle up, Buttercup. We're about
I
to.
say, mine are going to 3 different schools this year. So.
Oh,
So
gosh.
you get the extra B taxi between the schools and
Hockey and lacrosse.
hockey and lacrosse. And,
Yeah, so the first 6 weekends we have New Jersey, Boston,
oh yeah, it's not even just
Long
local.
Island.
No, it's not
yes,
local.
that's right. It's
Long
travel.
Island, Cleveland, Nashville, Pennsylvania. Yeah.
Oh
Yeah.
my gosh.
Yep.
Oh, that's
Good
why you
times.
wanted to book everything. So she goes, we got to get it in the books now, you guys. I was like,
Yes,
okay.
Yes, I will be otherwise.
That's why.
indisposed. Yeah.
That makes sense.
No, I think honestly, just trying to set forward a good routine to begin with. I know I'm taking screens away from my kiddos, and hiding
Yeah.
the television remotes and stuff like that.
Yeah.
So that they actually do their homework when they come home, because we have so much sports practices in the evening, and I'm like, you have to do your homework because school does actually come first, or it should, right? Because
Yes.
as I said,
Yes.
99.5% of these children will not be,
Professional
yes,
athletes.
Yes. So,
What?
plan B. Plan B. So,
That was my plan B. No, I'm
right,
kidding.
right. So, anyway, but yeah, no, I think just in trying to make sure that they get plenty of rest and, a healthy breakfast, not, my kids, I always give them breakfast, and then my middle one especially tries to sneak, like honey bun or something like that from
Heck
the
yeah.
cafeteria, and I'm like, Jack, no. So anyway, just healthy options.
All right.
You are what you eat.
Or don't. I'm a honey bun. I'm Chipotle today.
I was about to say the only thing we have eaten today is Chipotle. So
All right, so for medication doses, I actually do have a Google Drive that has the forms from the American Pediatrics Association. So I will post that in the little comments or in the description, so you guys can actually just click on that, and you guys can have the correct doses for both Tylenol and Motrin, so we can properly medicate. And for you adults, 600 to 800 milligrams of Motrin.
because 200 is not going
It's
to
not
do
going to
it
do
for
anything. No. And for those of you who are not allergic to Tylenol, you can take up to a gram of Tylenol.
you. That's just rude.
Hey, I'm
Real
one of them. All right. But if you have any questions, you know how to get a hold of us, because you guys have been stalking us on our personal accounts. So,
Yeah.
bye.
Bye.